All right, there's so much overkill, deadly Medicaid cuts in one big, beautiful bill. It is all wrong. Waste, fraud, and abuse, and some important eligibility savings. Joining us now, Medicaid and Medicare Administrator, old friend, Dr. Mehmet Oz. Mehmet, welcome, Mr. Secretary, or well, I guess we can't, Administrator. But anyway, you're Mehmet Oz to all of us who know you. So, you could have had a 50% increase in this thing. It's been growing since 2019. You're just slowing it down. As I look at some numbers, there's a New York Post editorial that I think came from your shop. It's going to go up 34% in the next 10 years instead of 50%. But the basis, you fill us in, please, the basis is a tightening of eligibility requirements back to the original bill pre-Obamacare, pre-COVID, and pre-Biden. This is really waste, fraud, and abuse. Tell us about it, Dr. Oz.
Well, just to reiterate, there is no scenario in which we do not spend more money on Medicaid than we spent last year. So the question is, how much more money, and how do we save Medicaid so it doesn't continue to grow 50% every 5 years, which is what happened. So if you go back in history and look at other programs that are similar, they're support programs like food stamps, which is the SNAP program, or TANF, which is temporary assistance to needy families. They have work requirements. Now, why don't we have work requirements for Medicaid? Well, the reason is 60 years ago, when the program was created, it never dawned on anybody that able-bodied people who could work would be on Medicaid, so they never bothered putting in work requirements. We're asking that able-bodied individuals who are able to go back to work at least try to get a job or volunteer or take care of a loved one who needs help or go back into school. Do something to show you have agency over your future. And if you're willing to do any of those things, we will check the box and you get to keep your free Medicaid. But if you're not willing to do those things, then we're going to ask you to go on and do something else, like go on the exchanges or get a job and get into regular commercial insurance. But we're not going to continue to pay for Medicaid for those audiences. And I think that is a very realistic effort. And it's been done in the past, actually under the Clinton administration, when they reformed the temporary assistance for needy families. They did it and they showed a dramatic 15% increase in workforce participation amongst those people. So Democratic presidents, Republican presidents have all felt that work was an important part of the deal with America, and we're just acting on that reality.
Yeah, I mean, it was Clinton and Gingrich. They turned welfare into workfare. It was vastly successful. We have some more numbers up. We're going to put them on the full screen, Emmett. Only 62% of able-bodied adults are working. Let me see. Yeah, most able-bodied adults do not work at all. 62%. Okay, that comes from your Medicaid agencies. That's bad number. We're going to put it up on the full screen. Then the second one, you mentioned food stamps, the SNAP program. Let's see. Not working. 74% of recipients of food stamps or SNAP do not work. That comes from the U.S. Department of Agriculture. Those are bad numbers. 62% don't work, get Medicaid. 74% don't work, get food stamps. We should put an end to that. And by the way, the states, I mean, they finagle the funding. The states are funding, the federal government, rather, is funding states as 90% sometimes to finance these able-bodied adults that should be working and aren't working. You're going to reform that too? 90%? I thought it was only supposed to be 50%.
Well, under the Obamacare expansions, they agreed to pay 100% for a while of able-bodied individuals added to Medicaid. Now it's 90%. But let me give you a stat that I think should alarm a lot of folks. If you're on Medicare, which means you paid into the system, that 2.9% of your paycheck every week for your whole life, you paid into Medicare, you get to age 65 or for whatever reason you get on Medicare, and now you look at what's going on with the Medicaid population, and you go to your doctor, and your doctor says, you know what? I appreciate that you have Medicare insurance, but the Medicaid coverage for an able-bodied person who has not contributed to the system actually pays me more, sometimes 3 times more than what Medicare pays me. You should be upset. We're fixing that. By the way, that was never supposed to be. In fact, even the Obama administration said you could not pay more for Medicaid patients than Medicare patients. That changed under Biden in 23. So 2 years ago, for the first time, we changed that. And guess what happened, Larry? Predictably, every state began pouring all the money into Medicaid and able-bodied individuals because they knew the federal government was picking up 90% of the tab. That doesn't make sense. It's not good policy. And most importantly, Larry, I have confidence in the American people. You give people a chance to work, and we know we have twice as many jobs as there are people looking for them. Go out there, do the entry-level jobs, get into the workforce, prove that you matter, get agency into your own life. It's a much more enjoyable experience if you're going through life thinking that you control your destiny, and you'll get better insurance at the same time.
100%. 100%. Well said, Dr. Mehmet Oz. Thank you, Dr. Oz. We appreciate it very much.